Welcome to Conversations with Kay. I'm Kay Ryder. And every week I talk with Vermonters who are leaders in the fields of government, healthcare, education, the arts, and community life. Well, we're into community life, healthcare, all kinds of things today. It's my pleasure to welcome back Martha Maksym. And with her is Brigette White. Now they represent the new, get this now, the new United Way of Northwest Vermont. Now that's a new organization. We're going to talk about it. And Brigette is the 2017 campaign chair for this new Tri-County United Way. Welcome.
Thank you so much, Kay. It's really nice to be back.
Nice to have you. Now this is an exciting year for you.
It is.
What Vermont counties are served by the United Way of Northwest Vermont?
We are proud, really proud, to be serving Franklin County, Grand Isle County, and Chittenden County.
Okay, now you're redefining your community,
Yeah,
definitely.
absolutely. Yeah.
Yep. You've been the United Way of Chittenden and Grand Isle County, and now you're expanding. Why did you decide to do this merger?
Yep. Well, I'll start, and I think then Brigette as a board member can add in. But it started well over a year and a half ago now. Back in April of 2015, the executive director at the United Way of Franklin Grand Isle Counties had tendered a resignation, and the board of that United Way, before they just went into hiring another executive director, approached the board of United Way of Chittenden County to just say, is there any opportunity for us to explore whether we might share services, whether there are other ways we could structure ourselves to better, really at the end of the day, do the work we want to do in our communities. And I think the Franklin Grand Isle United Way was relatively small, and finding it really hard to have the resources to do the work that they really were committed to doing in the community. So it was a full year of board-to-board conversations that ended in April of 2016 with the boards voting to merge and form the new United Way of Northwest Vermont. So it's now the three-county area, and as you said, we've really redefined our community to be this three-county area. When we were talking, there's so much crossover. I live in Grand Isle, work in Chittenden County. We have some board members who work in you know, across the three counties. There's so much back and forth that it felt actually like not that much of a stretch for us to redefine our community to be the three-county area.
Mm-hmm. Okay, now, do you have anything
Well,
else?
I was going to say the other thing to add, just as a board member, we know that there's a lot of nonprofits out there, and something that we're always asking organizations to look at is, you know, can you better align and get work done more efficiently by combining? And we thought, well, if we're asking other nonprofits to do that, it made sense for us to do that as well. And so it seemed to be a very natural.
Yeah, that makes a lot of sense,
Yeah.
actually, when you think about it.
Yep.
And we can talk about that a little more later. But you know, Franklin County is a pretty poor county, and as when all reorganizations come, Martha, you have to spend money to reorganize. Now, how much did you invest in this new venture?
Yep. So there were obviously costs associated with the merger conversations, and we were very fortunate to be able to get some donors who really helped us together offset some of the costs of the legal conversations, and we had an independent person facilitating the board-to-board conversations. The commitment that we made, and I think have been very diligent in following through on, is that we would actually be, at the end of the day, really investing more in the Franklin and Grand Isle regions in terms of staff capacity. So the Franklin Grand Isle United Way had 1.5 employees. We've now added another 1.5 folks on top of that. We now have 3.5 people that are working full-time in just specifically the Franklin and Grand Isle region. Obviously, we're all one team, but we've really made a commitment to make sure that we continue to have a physical presence in that area and to have staff who are really dedicated to working. And the only way you know what the needs are and how we can really address them is to have people in the communities, embedded within the communities, really in partnership with organizations and individuals in those communities. And so that's certainly been our commitment.
Okay. Is there a price tag on that?
I think that it's a little awkward this year because we're running sort of we're running, in essence, two separate budgets this year to honor the donor intent of the community campaigns that were run last year as separate organizations. So we're kind of combining into one, but honoring donor intent. So the budget with the campaign dollars from the Franklin and Grand Isle United Way campaign is about, this year, it's around $500,000. Up a little bit from the previous year, and then in Chittenden County, we've had the capacity to really be able to leverage we leverage almost another $900,000 in grant funding to support and add to what we were able to raise in our community campaign. But overall, the budget now is just over $5 million, and we really have, again, a commitment to invest where the needs are. Across the three county communities.
This is the budget for the 3 United Ways.
For the one United Way of Northwest Vermont, yes.
Pardon me.
That's
right.
Right.
Across 3 counties.
Yeah, there we go.
That's
okay.
right. Yeah.
Okay. What is the same in the 3 counties? You have Chittenden, Grand Isle, and Franklin. What are the same in those 3 counties?
In terms of needs.
Oh, needs. What's the same?
I think a really deep sense of commitment to community and community well-being. I think that across this whole Northwest Vermont, there is a real commitment to volunteerism. We have amazing people volunteering on our boards, on communities, helping at community nonprofit organizations.
I was thinking in terms of community needs.
Yep. But I want to just say, I think that there's a rich capacity within all of the communities, whether they are perceived as being poorer or not. I think that people really care deeply about their communities. We're in the process of doing some needs assessment work right now, things that are coming up across all 3 counties. Mental health and substance abuse, doesn't matter who you ask. The Hospital Northwestern Medical Center just did a needs assessment. Mental health and substance abuse was by far number 1. UVM Medical Center did a community needs assessment. That's the number 1 issue. We're doing our needs assessment work. That is coming up. Far and away, those 2 issues are the highest across all 3 counties. Housing, affordability of housing, access to housing, homelessness is coming up across all 3 counties. Transportation is a little bit more of an issue in Franklin County. That it's showing up mostly in Franklin County. Hunger, I just heard a statistic the other day that 1 in 3 children in Grand Isle County are living in food insecure households. It's 1 in 7 in Chittenden County, about 1 in 7 in Franklin County. So I think 1 in 3, that was kind of an alarming statistic. So I think the things that we think about are really things that are our needs across all 3 counties. With
Franklin County being more rural, of course, transportation would be much more of a problem there.
Right.
And, so that makes sense to me. Now, this year's campaign, Brigette, will raise funds for future in all 3 counties.
Correct.
How will funding decisions be made to support the programs in each county?
The funding decisions it's based completely on volunteers that get together and really look at what are the priorities and where can we have the biggest impact. And so that's essentially how the funding is allocated. And again, I think it's really important that we note that it is all volunteer based, and the process is really, and I've been personally involved with it, it's a very impressive process in terms of everyone taking a little piece, getting back together, and really figuring out where the priorities are and where we can essentially get the best bang for the buck. And it really, the other piece of it that's really important is the accountability factor, making sure the agencies and the programs are really doing what they say that they're going to do and having the largest impact.
Yeah, that's important, isn't it? Making sure the work is done.
Yeah.
Well, absolutely.
Yeah.
Absolutely. And we hold their feet to their fire. Their feet to the fire.
Well, that's good. I think that's really good. Now, why did you want to chair the Tri-County
Wow. Why did I want to chair? Well, that's a good question. Essentially, I was honored to have been asked, and I really, initially I said to Martha, no, I can't do it. I've got too much going on and too many things. And then I thought, you know what, I love this community too much. And it's easy to say, have someone else do it. And so I decided that I honestly care too much. And so I gave it some good thought, checked with my family, who was completely supportive of me and my business partners. And so here I am, and I'm really quite honored to be leading this effort.
Yeah. I have always believed that if a woman is asked, she should do it.
Well, thank you, and I said yes.
Good for you. I think that's really good. Now, where do you work?
Hickok and Boardman Financial Planning.
Right.
And so Hickok and Boardman has very deep-rooted community service sort of in our DNA, and my business partners were also very supportive of me taking on this effort because it will take some time.
Well, of course, the business contributions to the United Way are extremely important. We all know that.
Paramount.
Right. Yeah, right. Yeah. So
Let's not underestimate that.
It sounds like you're very excited about
Yes.
this new Northwest United Way.
Yes. And we don't yet have a campaign goal. We're still meeting with companies and trying to figure out exactly what that's going to look like. But we expect that it's going to be over $4 million in that range for the Tri-County area.
Yeah.
And the businesses, corporations are the backbone to this effort.
Sure.
Yeah, if I had to think of two things with the United Way, well, three things really. Number one, you're organized and you work all year.
Yep.
And number two, you have so many volunteers out there.
Absolutely.
And number three, you have such strong business support and personal support within your area. And those three are just the great triumvirate, aren't they?
Can I add something to that
Sure.
that you said? I mean, the idea of us having the business support, which I agree completely. And I can't tell you how important that's been when we are trying as a community to address issues of mental health or substance abuse or homelessness, because these are issues that impact the business sector.
Yep.
These are issues that impact their employees, and our ability to bring the business community to the table, government to the table, healthcare to the table, to really talk about these issues. It's not, if anyone thinks the nonprofit sector alone is going to be able to solve some of these, it just can't happen. And so we need the relationships and the resources of the other sectors, and the great support and wonderful relationships we have with the business community really, really helps us have the impact that we want to have.
Now, Martha, you and I have talked before about the complex problems.
Yeah.
And you've just noted the people who need to address them.
Yeah.
I would add government to
Yes,
that
absolutely.
list.
Yep.
And will this new United Way setup be better equipped to help with the huge issues of heroin and drug abuse?
Yep.
Now, they have big problems in St. Albans.
Yep.
Can you address this?
Yeah, absolutely. I think that, yes, we'll be better. I think that this issue does not end at county lines. I think Grand Isle, there was just an overdose in the Grand Isle community of a young woman not too long ago. I mean, it's touching all of us. And so I think to be investing in trying to address this from a prevention standpoint, an intervention standpoint, treatment resources, recovery supports, making sure that people can get to work if people are in recovery. Again, that's where people may need to cross county lines. Right now there's not a hub, a methadone clinic in St. Albans, although there's one getting ready to launch. But right now folks are coming down to Chittenden County to access that kind of treatment. I mean, we really, hopefully if we can organize the resources across the 3 counties that are being invested in this, there's some efficiencies of scale, I think, that can be created. There's some sharing of best practices. And so I just think it's going to take a lot more than just what United Way can invest in this issue. And I think the more people we have around the table working on it, the better the likelihood of success will be.
A recent opinion piece in the Wall Street Journal, of all places, said how bad the drugs were in Vermont. And I think it's an international problem. The drugs come through Montreal and head through Vermont, heading for New York City.
And south to north.
Yeah, too. And it's a big problem.
Yeah.
And we're on the conduit route, if you will. And,
we sure are.
I think that they overemphasize things for the problems in Vermont.
Yeah.
But that's my personal opinion, since I live here.
It is across the entire country,
absolutely.
For sure.
Oh yeah. In the Midwest, of all places.
And there was actually just a study that came out, Kay, that said Vermont was one of only 4 states who actually had made great progress on trying to really address it. So I think that Governor Shumlin's State of the State a couple of years ago that really said we have to address this was a very courageous step. And so maybe Vermont is being highlighted more for it, but I think it's because we've owned it in ways that maybe other communities haven't yet.
Issues don't go away because you try to hide them.
Right.
It's better to, you never know what's wrong unless you hear about it
That's
and
exactly
see it and try to do something about
exactly
it. That's
right.
one thing I really credit Governor Shumlin with. And a lot of people said, oh my God, so on and so on. But I thought that was good that he did that.
Yeah, because it really said we all have to address this. You can't pretend it doesn't exist anymore.
Now, you have said that the merger will help you address what you call the, quote, building blocks of a vibrant community, end quote. Let's start with education.
Yep.
How will this merger help with education? Brigette, can you help me with this?
In terms of education, there's, specifically I can't speak with a lot of the programs yet. I'm still learning what Grand Island, Franklin is offering. But I think as we're just aligning resources and using best practices between counties, that absolutely helps. The other thing that I know that directly impacts, which is one of my favorite programs, is the foster grandparent program that operates in both Chittenden County as well as Franklin counties.
And Grand Isle.
For Franklin and Grand Isle counties. And that to me is one of the most beautiful programs because it takes lower income seniors and pairs them with higher risks, young children. And these folks work at least 15 hours a week in a school or in a child care setting.
Right.
And if you've met the foster grandparents and met the children that they pair with, it's amazing.
Yeah, that program was bound to succeed because grandparents and grandchildren have a common enemy.
Mom and Dad.
Okay.
That's right.
I was thinking bigger, but
that's exactly right.
You're absolutely education, and then we all know that education has to start with those who are young,
right? And their parents.
Yeah, we can't catch up. That's one thing we can't catch up on. We really can't. We can't catch up on lots of things, but education completely. That's one of them. Now, Martha, when we talk about health in this, several groups. We mentioned the foster grandparents, and we have the Visiting Nurse Association and the community health centers are already in Grand Isle County, like the foster grandparents are, but they're a 3-county organization, as you pointed out, Brigette. So do you plan to use the expertise of these organizations that have branched out already to help you?
Oh, of course. Absolutely. And there are a number of organizations. So in Franklin County, it's Franklin County Home Health, as an example. In Notch are the federally qualified health center that is the Franklin County equivalent of the community health centers in Burlington.
What is Notch?
Northern County, Northern Tri-County, I can't remember.
Never mind. It's
Notch
okay.
is an acronym, though, for the community health center in that
Healthcare
area.
has a lot of those.
That's right. And so we are, again, as we're trying to move the needle on how we keep people healthy, allow people to live independently, we're absolutely using the expertise of all of the folks that actually are working with individuals in those communities. So we have strong partnerships with the home health agencies, with the health centers, with the CAP agency, the Community Action Agency, which works, that CVOEO is across all 3 counties, and it goes into Addison County. CVOEO is Chittenden, Franklin, Grand Isle, and actually Addison County. There are several other organizations. Champlain Valley Agency on Aging covers the 3 counties. Prevent Child Abuse Vermont is doing work across all 3 counties. The Foster Grandparent Program, as Jet said, is across all 3 counties. So, but we really, these agencies are our partners, and they are the boots on the ground that are really working with folks, and they have the best information for us about what we could do to have an impact.
Yeah, and they have also contacts with a group that has specific problems. Now, Vermont population is aging. We're getting older like mad.
Yeah.
So you think that this will help our older citizens?
I hope so. We're in some really interesting conversations right now. We know and are watching, just like the rest of the state, the trend of the aging of our population. And so we have spent the last year in Chittenden County, and we hope to gather similar information in Franklin and Grand Isle counties, talking specifically to seniors, older adults, about what do they need, what are the services that they need in 2016 and beyond. How do they want to hear about it? So many of our seniors are now using email, they're online. I mean, just the methods that we have, the vehicles we have to communicate with folks are very different. And how do they want the services delivered? And so these conversations are really informing our thinking about what's the service delivery. Look at what's going on in healthcare and how important it is to keep people healthy and keep them in their homes as long as possible.
Absolutely.
And so what does that mean in terms of how we look at what are the services that need to be delivered? How do they need to be delivered? How do we communicate about them? I mean, it's really, it's a little bit daunting and very exciting about what we could really do.
Now, I believe that
this.
you have a video for your campaign this year, Brigette, and we're going to show this at the end of the show. It's going to come on right at the end of the show. So hang in there, folks. Don't go when we go, and see the video. And now, before I forget, you have a telephone number and a website for people to go to?
Yes. So our website is unitedwaynwvt.org, unitedwayofnorthwestvermont.org, and the phone number is 861-7852. Is the direct line that can connect you to our St. Albans office or Chittenden County office.
Okay, great. Now, we don't have a lot of time left here, but...
this always goes so fast.
Oh, it does, doesn't it?
Yes.
Brigette, why are we stronger when communities work together? Now, we have all these problems, we've talked about them, but we're talking about the future of Vermont.
Right.
Why are we stronger when we work together, do you think?
Everyone's stronger when we work. I mean, think about a team, right? If on a team you have a bunch of individuals that are all moving in different directions, you're really not moving forward. And so it works the same in businesses, and it absolutely works the same in communities. And so, we all want a healthier community, absolutely. And so if everyone can just do a small piece, some focused piece, and we can all align and we can move together. And I think our chances of solving a lot of these highly complex problems is actually doable.
Yeah.
I applaud that speech. That's great.
Yeah.
Martha?
There's not much more I can say to that. I just really believe that if we are working in parallel silos as a community, the business community, government, law enforcement, education, healthcare, the nonprofits, I mean, what we're dealing with are issues that cross all of this. And so by working alone in our silos, I just think we're missing access to incredible resources that are being invested, incredible knowledge and expertise. And I just think it can just create a greater sum if we're all sort of working together and have greater impact.
Right. So I applaud you. You're taking
So
on a
do
big
I.
job. You're taking
So
on
do
a big
I.
job.
Thank you.
It sounds like you're absolutely committed to it. And
Absolutely.
I wish you success.
Thank you.
And Martha, carry on.
Kay, thank you so much. It's
Yeah.
always such a treat for me to come, and really, we're very grateful
Well, thank you
for
for
the
coming.
opportunity. Thanks
And
a lot.
remember out there, young or old, rich or poor, rural or middle of Burlington, you know somebody who's been helped by the agencies of the United Way. Thank you for joining us, and thank you for joining us on Conversations with Kay.